Welcome to the Healthy Habits for Active Aging podcast with your hosts, physical therapists Dr. Michael Gorman and Dr. Lauren Bennett. This podcast will discuss a variety of health-related topics focused on educating the aging adult, allowing for an active lifestyle no matter the age. Don't forget to rate, subscribe, and share. Enjoy the show.
Hello and welcome again to the Healthy Habits for Active Aging podcast. I'm your guest, Dr. Michael Gorman.
And I'm Dr. Lauren Bennett.
And we're two doctors of physical therapy from the beautiful city of St. Louis, Missouri, where we are bracing for the Arctic cold, which is, it's coming in just a few days. So probably by the time you guys hear this episode, we'll be fully thawed out.
Yeah, they're talking like wind chills in the negatives, and
yes,
I don't know how I feel about that.
I don't either, but I guess that gets us one day closer to spring.
That's right.
All right, so we have last episode, I believe, well, maybe 2 episodes ago, didn't we have a trivia question?
Yes. So 2 episodes ago, we asked for people to email us our trivia question, which was basically just the question to email us a fact that they knew about the SI joint, which is the sacroiliac joint, the joint that connects the pelvis and the spine. And the trivia question about the SI joint is that it is actually the largest joint in the body. So while it does not move very much, like 2 to 4 millimeters, the surface area is 17.5 square centimeters, if you ever need to know exactly, which is probably a little bit different on everybody, but it is the largest joint in the body.
Well, that's a good party trivia question that everyone should have a know, but thank you very much. I do not believe we had a correct answer. We had a few people that emailed in, but unfortunately, no winners this time around, but we'll make sure to continue with the trivia.
Okay.
So today we're going to be talking about balance. And this is something that Dr. Bennett and I deal with our patients day in and day out, whether you're my age, which is an aging adult, which is 53 or you're 63 or 73 or whatever age you are. It's not uncommon to start to have a little bit of decrease in balance. So that's what we're going to dive into today.
Yes. And I would say that I get the question, I don't know about you, Dr. Gorman, but literally if it's not every day, it's every other day why is this normal? Why is my balance feel so much more challenging when I get older? Is this normal? Is something wrong with me? Can I make it better? What can I do? And so that's literally the topic of why we chose to talk about this today, is that there are things that you can do. And yes, it can be a natural part of aging. And so today, Mike and I are going to discuss why this can happen to you and what are the symptoms. And then we're going to go over a few exercises that you can hit on to help slow down the depreciation of balance.
Right. And I think it's so important for everyone to know that this is normal.
Mm-hmm.
Loss of balance is normal. It doesn't mean you have to give into it and not do anything about it, but there's 3 main components that really make up our balance. And once we tell you these 3, you'll start to understand why if you have a problem in one of those 3, it's a huge impact. So the first is hearing. The second thing or second component that makes up our balance is vision. And the third is a fancy word called proprioception. I like to tell patients just your body's awareness of where it is in space. But if you have vision problems, which most of us do as we get older, that's going to immediately affect balance. If you have hearing problems, which again is most people as we age, and then if you either don't exercise or you have an injury and you stop moving or you have knee surgery or hip surgery, you're going to have that altered proprioception, which means that your body, your joints of your body or the injured joint lose its ability to sort of function, to know where it is. So these 3 components, if any of these 3 are off, problems with balance, and if all 3 of these are an issue, major balance issues.
Definitely. I'm glad you brought up this surgery. I as a physical therapist, balance is like literally in every single one of my plan of cares, especially like lower extremity. If you had a total knee replacement, you may be thinking, I need to work on range of motion and strength. And while that is true, at some point you have to work on balance, because patients, like, they'll literally say, I feel like Bambi, just super uncoordinated, unsteady. And the reason behind that is that when you're cut on, there's cells in your joints of your body that are specifically do the function of balance and stability. And so that whole cellular process when you're cut on is just disrupted, and so you have to challenge them and retrain them again and get them back to their prior level of steadiness.
Right. And the important thing to do is that be proactive with this. So there's questions that you should ask yourself if you're unsure if you're having a balance problem or not.
Mhm.
So let's just run through these. First of all, do I feel unsteady? Do I feel dizzy, or the room spinning around? And if you have those issues, you may very well have some vertigo or something called BPPV, which we'll talk about in a different podcast episode. Do you feel, have you lost your balance? Have you had a fall? Is your vision becoming blurred? All these things are, important, real important questions that you should be asking yourself. And by all means, if the answer is yes to any of those, seek out medical help. Don't get on Google. Don't get on the World Wide Web and try to figure out your balance issues. There's trained professionals that's what we do. So please seek out help if you're having these problems, because I don't know if we're going to get to it or not, but we don't want it to get to the point to where you have a fall and you fracture a hip, and because things generally spiral down after that. So let's be proactive.
Yes, that's a very good point. And sometimes it can be multifactorial too. Sometimes you can say, this is what happened. I had surgery, or I have a history of vertigo and I know what that feels like. But it could be blood pressure too. There's this thing called orthostatic hypotension. And so sudden changes of movement. So you get up really fast from sitting or standing up. Well, your blood pressure can drop pretty suddenly, and then it will come back up. But in that time that it drops, you will feel like the room is spinning or lightheaded. And so that is not a normal condition, but it is something that can cause balance problems. And like Dr. Gorman said, the room is spinning, lightheaded, feeling of faintness, feeling like you may fall. These are all symptoms of balance problems.
Yeah. So, your loss of balance could be coming from an orthopedic problem,
Mhm.
a knee, foot, and ankle problem. It could be coming from a blood pressure issue. There's a whole
Mhm.
host of things. So please, we want you
Yeah.
to get the right help.
Yeah.
So more things that are going to affect your balance. We've already talked about vertigo, BPPV. We've talked about blood pressure, but some things that sometimes we don't really think about, and there's something called peripheral neuropathy, diabetic neuropathy. That's just where the nerves in your legs just start to lose a little bit of their function. They start to not do what they're supposed to, so you have less sensation.
Yes. And like Dr. Gorman said, the proprioception, which is your body's awareness of space, that's where the neuropathy really affects. If you can't feel your feet, you can't feel your shoes on, you can't feel the floor, you're obviously going to have a little difficulty with feeling your body's awareness in space. We talked about vertigo. So another inner ear problem, if you have like an infection in your inner ear, it doesn't even have to be vertigo necessarily. But any inner ear infection can cause balance problems, just unstable joints, whether you had surgery or not. Say you have weakness in a particular leg, then that will cause balance problems. There could be medicines. It could be a side effect of medicines that you are on that can cause balance problems. So antidepressants and sedatives can be notatory for balance problems, low
And
blood sugar.
yeah, and if you think about that, sometimes whenever we start a new patient, we always look at what their medication list is. And sometimes
Mhm.
I'm personally overwhelmed because it may be a list of 10 to 15 different medications, and they're all interacting somehow, and so that is affecting your balance. Is definitely a big medication side effect. So if you start on something new, if you start taking a new drug for anything, and all of a sudden you see something that starts to change, give your physician a call and let them know. It may be totally expected, and it may be something that after you take it for a couple weeks, it goes away. But you should be sure to let whoever
Mhm.
prescribes that medication for you to let them know.
Yeah, it just be open with your doctors and talk to them about it. Make sure it is just a normal process of aging, because there are some neurological conditions out there that sometimes may go unnoticed until people start falling. And then when more tests are done, they could find that maybe you have a nerve impingement somewhere in your spinal cord, or a progressive neurologic disease like Parkinson's or multiple sclerosis. Anybody that has that will definitely say that balance is impaired. And so, just, not that that's the first thing you should jump to,
Right.
but it's just something
Right.
that needs to be at least brought up with your doctor, and make sure all the stars align for
Yeah, I
you.
mean, or it could be, I know you said some really bad things in there, Parkinson's, and I don't know if you said MS, but all those things. But we just want it. It probably isn't that. We're just telling you right now, but
Yeah,
it could
right.
be something that you just need to move, and you just need to exercise,
Mhm.
and you need to take this machine, which is your human body, and make it work. And all of a sudden,
Mhm.
if you start doing that little by little, things get to be a lot easier, including your balance. So, well, I
Yeah.
tell you what, Lauren, we've talked so much. I'm a little about our breath, and I'm a little lightheaded myself. So this is a wonderful time to jump to a commercial from our sponsor, iMove PT. So please enjoy, and we'll see you back in about 30 seconds.
Okay.
iMove PT is proud to be the sponsor for the Healthy Habits for Active Aging podcast. iMove PT is a mobile physical therapy company based out of St. Louis, Missouri, and expanding throughout the United States. We bring a unique one-on-one physical therapy experience to the privacy, safety, and convenience of our patients' home, office setting, or the location of their choice. For more information about iMove PT, please go to www.imovephysicaltherapy.com, or feel free to email us at info@imovephysicaltherapy.com. Have a great day. Okay, we are back from commercial break, and during our commercial break, we talk about all kinds of things during our 30-second break, and I just learned today that Dr. Bennett, she had her first cavity filled today, and I am so impressed by you that I'm not going to guess your age, but people can guess, but you've never had a cavity. I think by the time I was 11, I had 12 cavities or something like that. So good job.
I don't want any more. I don't like that feeling of half my face being numb.
Great job. Great job. Okay. So you have a balance issue and you're struggling with it. So we're going to just talk next about what can you do about it. So Lauren, why don't you tell us a few things?
Yeah, sure. So if you refer back to one of our original podcasts, I think maybe episode 2 or 3, we talked about the American College of Sports Medicine guidelines for exercise for the healthy adult. And it's, strength, flexibility, and balance. Balance is a major component. And it's very important that at least twice a week, you spend about 10 minutes at a time working on balance. Like we said, to stimulate those cells in our joints, to improve our proprioception. So there is there's like 8 exercises that are the top exercises that they actually recommend. So we will talk about those here, and then we'll kind of cycle back about things to do for
Yeah. So I
for
think
safety in the home.
yeah, let's talk about that first, because here we are,
Okay.
we're talking about all these things that cause balance issues, and we're going to show you some great exercises that you can do as well at
Mm-hmm.
home. But one of the first things that we always look at when we go into a patient's home is, let's look at just your home setting. And do you have loose rugs? Because Unfortunately, most homes that we see, there are, loose rugs and like throw rugs and slip rugs and those kinds of things that they're very easy to fall. I can't even tell you, I don't have a balance issue, but how many times in the last 2.5 years I've almost fallen, walking or stepping over one or, starting to fall on one. So you need to make sure that you need to take those little small rugs up, or if you don't want to take them up, use that whatever it is, that double-sided tape that you can use for rugs and carpets and things
Mhm.
like that to make it secure.
Yes. And we actually offer that service too, to have a therapist come on from iMove PT. A therapist can come on out. And if you're not sure, just give us a call, because we have therapists that literally will come evaluate your house and give you recommendations or do things themselves to keep you from falling. And
Absolutely.
rugs are a big one. So 1 in 10 falls can lead to a fracture, and then that sets people back with more comorbidities and other issues. So just a little another knowledge of trivia there, but don't let that be you over something that could be so easily prevented.
Sure, for
So,
sure. All
okay.
right.
Are we
So
ready to get into the
we have
exercises?
not only did Dr. Bennett today, she get a cavity fill, but she's going to demonstrate some wonderful balance exercises and at least a few of them.
Yes, I'm going to do a few of them. But I'll go through the list of the ones that are recommended that actually does improve your balance. Just full disclosure, when you're doing these, if you are unsteady, or even if you're not unsteady, please do this near something stable. I would recommend a countertop rather than a chair that may move. So kitchen sink is always a good idea. Keep your eyes open. We talked about things that can make things harder, right? We talked about vision, hearing, and proprioception. So as a therapist, when I'm working on exercises with patients, sometimes if my patients are listening, I'll be like, yeah, I know. I'll have them close their eyes. Okay. That's taking your vision away. So now we're relying super heavily on our other 2 senses, which is our ears and then our feet. And then hearing, I don't usually take away, but a lot of times my patients can be hard of hearing as it is. So even if they're hard of hearing and then I tell them to close their eyes, they're like, what are you doing? And then sometimes I'll make them stand on something fluffy, like fluffy carpet or a pillow, or we have this particular pad in the PT world that we use. And that makes things even harder. So we even tell you to close your eyes while you're standing on the pad. You're really going to hate me. But anyways, that's my soapbox of the progression of exercises. So here is single leg stance is the first one. It is exactly what it sounds like. You are standing on one leg with your eyes open near a countertop or sink and just trying to hold that. So 3 seconds is usually what I shoot for with a lot of my patients, because when you are walking in the gait cycle, there is a little period of time where you are standing on one leg as the other leg is advancing, and you are only standing on one leg. And even if it happens in a split second, people that can't hold balance on one leg will feel unsteady when they walk and then feel more comfortable with a cane or a walker.
And
So
here's a little tidbit for everybody. If you have back pain, oftentimes with back pain, you get sometimes you get hip pain in the buttock area, but most times on the side you're having most of your back pain, that hip will start to get a little bit weak. So therefore, don't be surprised if standing on that leg that's been affected from the back pain, which is causing muscle weakness of the hip, don't be surprised if that's a struggle for you.
Okay, so I'm going to demonstrate the next one, which is called a tree pose, which is a little progression of the standing on one leg. So a little bit harder. I'm going to back up and try to talk loud here. So you are standing on one leg with the other leg essentially up on the thigh of the opposite. And then you're just kind of doing a prayer pose right here. And of course, when that gets easy, you can do all kinds of crazy things with your hands. But essentially, this is the tree pose.
Now, can you do that on the other leg?
Oh my gosh, you have to challenge me. Let's see. Okay.
That's very good. I will tell you that when we always talk for a few minutes before we go on the air, and And Lauren did try that tree pose, and it was not nearly as well as what she just did. So she must be a true performer. She needs to be on stage with an audience before she does well. Good job.
Okay, so Tai Chi is another group of exercises that's like a whole thing in itself, kind of like yoga, which is also recommended. There's lots of videos out there that you can follow.
I'm going to do a little plug for a gentleman by the name of Sean Tucker. Sean's a physical therapist in Brentwood, Missouri, which is in St. Louis. And Sean owns a Brentwood Center Health, and he is a Tai Chi guru, and he incorporates it into his physical therapy practice. So if you're in St. Louis and you want to learn more about it, obviously reach out to us, but I would tell you to talk with Sean Tucker.
Awesome. Okay, so there's this thing called tandem walking, which is essentially if you pretend you're walking on a balance beam, or you're like a gymnast walking on a balance beam. It's the heel to toe, one foot in front of the other, which is a lot more difficult than it sounds.
Or if you've ever been stopped by a police officer in your earlier days, maybe you did the tandem walking and didn't know what it was called.
Yes, that is the typical joke. So, and then, if you're struggling with that, do it again near a countertop, or use your cane or walking sticks. It's not that you shouldn't do it, because if it's just too difficult in the beginning, spread your feet a little bit. It doesn't have to be exactly heel to toe. It can be a little bit wider of a base. And then as you get better, progress and go more heel to toe. So, there's multiple progressions of these things. Lunges. Dr. Gorman's going to make me demonstrate this one too.
Oh, come on. I'm not going to make you do anything. You volunteered for this.
I could use some. Okay. So, 1 foot in front of the other. I'm going to have to lower this a little bit. So 1 foot in front of the other, and then you'll just drop that back knee straight down. So that way this knee goes right over the toe. You do not want to go like one of these moves where you bring your hips forward and your knee goes way over your toe. It's way too much stress on your knee. So you need to just think about taking your hips, dropping it straight down. And it's really not even about how low you go, because this is for balance. So the more lower you go and the movement starts, you might feel a little wobbly. Again, you can use a stick and just little oscillations. Okay. And then make sure you also do both sides.
Yeah. Perfect. Okay. Perfect. That was great. Great job.
Yeah. And then the last one that's recommended in the ACSM are sit to stands, which is exactly what it sounds like. It's beginning from a chair and standing up. And we recommend to do that without the use of your arms if you can. If you have to use the armrests for just a little bit of stability, that is okay as well. But try to make that a progression of yours. And worst comes to worst, you're just falling straight back into the chair. That's right. That's to help improve your strength, because we talked about unstable joints contributing to balance deficits, and that will help make you stronger. It's like the most functional activity you can do.
Absolutely. So there was a 2016 study that showed that adults who did balance exercises for just 6 weeks, and I don't know, Dr. Bennett, was it daily or 3 times a week they did exercises, or?
I believe it was 3 times a week.
Okay. So 3 times a week for 6 weeks, improve their balance, they gain confidence, improve coordination, improve leg strength. So we're not talking that you have to spend hours doing this, nor months and months. I mean, you can see substantial gains really in a hurry. So it's not like you got to do this for a year before you see some, but the most important thing is to just do it, to really just start. I hate to use the Nike phrase, but it's true. Just do it and just get started.
That's right. So we already talked about using something stable, or countertop or chair or something, but also I tell my patients to focus your gaze or your vision on something to make you more steady. And have you ever heard this, Dr. Gorman? When I played soccer, we would have to do this like balance stretch or something, and they always told us to hold our earlobe. Did you ever hear that trick?
No.
I don't know. In all my research, I didn't see anything that was like, hold your earlobe, but I'm starting to get convinced that my coach just wanted to see all of us holding our earlobe.
Oh, did you have to pat your head and rub your belly while you
at the same time? I know. I'm starting to think I was lied to my whole life in youth sports.
So we're gonna recap the main couple of things. First of all, there's three components that make up our balance, and if you get nothing more out of this podcast, please understand that it's your vision, it's your hearing, and it's your body's awareness in space, of space, which is called proprioception. Not space up by the moon, but space on Earth, on the ground. If any one of those or all three of those are impaired somehow, either by age, by injury, by trauma, then you will have a loss of balance to some degree.
Mm-hmm. And also, please understand that it is normal for your balance to decline as you age. We have a loss of circulation, a loss of nerve conduction, vision and hearing becomes harder, and our spatial awareness. So do not think that something is wrong with you. It's certainly something you want to discuss with a healthcare provider, and could just be as simply as, yes, this is aging, and here's a physical therapist to work with you, and they will get you on an individualized program, specifically challenging for you now and progressing to be challenging for you later as well.
Yeah, and I think what you just said is so true, that you need to go to a qualified physical therapist that can create an individualized program. Well, first of all, we want to do an individualized evaluation of your strength, of your range of motion, of your back. How's your back doing? Because there's these 40 miles of nerves coursing through our body coming out of our spine. So if something's going on up in the spine, it's going to affect your strength in your legs. But we want you to make sure that, again, yes, you can go on to the World Wide Web and you can find things to start on, but why not get with a specialist to determine what you actually need?
And a little thing here, like, you guys don't have to know this, but you may be sitting here thinking, well, how do they know what my baseline is? And how do they know if my balance is poor? Or how can they predict if I'm going to have a future fall? Physical therapists are actually trained in school on special tests that they will do. And there's a lot of research out there on things called a Berg balance test, a test called a tug, where you literally get up, walk 10 feet, turn around, and you get certain points for doing certain things, and they do time, and depends on the level of assist the therapist has to give you. These are concrete, objective tests that therapists can do on day one and tell you, if you fall between this number and this number, you are a low fall risk. We recommend that you're okay. Or if you fall between this number and this number, you're okay to walk in your house safely, but to be a community dweller, we recommend you use an assistive device, and so on and so on. And then it's really cool when you get to like 10 visits into therapy, they may do a evaluation on you. You'll repeat those exact same tests and measures, and you may surprise yourself. Somebody that doesn't, living it every day might not see your progress, but it's so cool as a therapist to see somebody, improve a test score by 5 points. And like, say 10 visits ago, you couldn't do that.
Absolutely.
So yeah, things are measured in much. It does work. Let me tell you, it's one of my favorite.
I think it's hard.
Things.
It's kind of like if you're trying to lose weight, it's hard seeing in yourself day in and day out, but it's when you can kind of reassess and recheck. That's why I don't encourage people to get on the scale every day and weigh, because it's going to fluctuate, but maybe one time a week get on that scale to reassess. So I have no idea how we got on that subject. But we got to come back to those. But anyway, next week we are going to be presenting a topic called stem cells, as we start to discuss the field of regenerative medicine. And I think that that's been a buzzword for a while. It's a pretty awesome thing, what's going on. We don't know what all is going to happen in the future, but Dr. Bennett and I will have a great podcast next week. So we do hope that you come back. We appreciate you guys. If you like this, please share this with just one person. If you can share this podcast with one person that's having a balance problem, you will make a huge impact in their life. I can promise you that.
So thank you so much for joining us today, and we hope to see you next week on stem cells. As always, if you have any questions, comments, or suggestions for future topics, please give us an email. We would love to see them. info@imovephysicaltherapy.com. We'll see you next week.
Yep. See you next week. Have a great day. Bye-bye.
We hope you've enjoyed this episode of the Healthy Habits for Active Aging podcast. If you have any questions for Dr. Gorman or Dr. Bennett, please send an email to info@imovephysicaltherapy.com. To learn more about healthy aging, visit our website at imovephysicaltherapy.com. Like what you hear? Be sure to rate and subscribe. See you next week.